You know that feeling, right? That just uh, persistent ache deep in your lower back.
Oh, yeah.
The kind that makes sitting at your desk or, getting a good night's sleep or even just enjoying a walk feel like a chore.
Mm-hmm. Absolutely. So many people deal with that.
Exactly. If that sounds familiar to you listening, well, you're definitely not alone. Today, we're doing a deep dive into one specific way people are finding relief.
Right. And crucially, it's an approach that doesn't involve invasive procedures or relying solely on medication.
We've been looking at some material from a piece called Chiropractic Treatment for Lower Back Pain, A Journey to Recovery.
Yeah, it really focuses on one person's story, their experience with chiropractic care.
So our mission today is to unpack that story. We want to understand how chiropractic care, at least as it's described here, tackled this person's lower back pain.
And figure out, what are the key takeaways if you're maybe considering something similar yourself.
Okay, so the source material. It kicks off with the core concept of chiropractic care for back pain, focusing on spinal alignment.
Uh-huh. The basic idea presented is that how your spine is aligned really impacts your nervous system.
Right.
So if the bones in your spine, the vertebrae, are out of whack, it can potentially put pressure on nerves or irritate them.
Which can lead to pain and other issues.
Exactly. And the chiropractic approach described here uses gentle adjustments to try and correct those misalignments, restore function, ease the pain.
And like you said, the source stresses this is non-invasive,
Yeah.
no surgery involved.
That's a key point they make.
Now, to make this really concrete, the source tells the story of a specific individual, a Mr. Johnson. What was his situation?
Well, Mr. Johnson's story is probably quite relatable for some listeners. He'd been suffering for a long time. Persistent lower back pain that was, seriously messing with his daily life. Work, sleep, just enjoying things.
And he tried other things.
Yeah, he'd gone the traditional medical route, but the relief he got was only temporary.
Which is so frustrating when you're living with chronic pain.
Absolutely. That cycle of pain, temporary relief, then back to pain. It's tough.
So he was looking for something different, something that might actually last.
Right. And that's how he ended up finding Advantage Healthcare of Spartanburg.
Okay, Advantage Healthcare. What did the source highlight about them?
Well, it specifically mentions their experience, over 30 years in chiropractic and accident rehab.
Okay, that's quite established.
Yeah, and it gives their location to 1205 John D. White Senior Boulevard in Spartanburg, South Carolina.
For someone like Mr. Johnson, finding a place with that kind of track record must have been, reassuring.
You'd think so, yeah. That longevity can definitely build confidence.
And within that clinic, there was a specific chiropractor involved, Dr. Vinaman Korikov. What was his part in this story?
Dr. Korikov seems pretty central to Mr. Johnson's positive experience. The source notes that he really took the time to listen.
That's important.
Super important. Understanding the pain, how it affected Mr. Johnson's life, and then, crucially, explaining the why.
Explaining the potential source of the pain.
Exactly. Helping the patient understand what's going on. That itself can be therapeutic,
Definitely. And after that?
Based on that understanding, Dr. Korikov apparently developed a personalized treatment plan tailored specifically for Mr. Johnson.
Okay, let's get into that healing process then. The source mentioned spinal manipulation first. What did that actually involve?
So spinal manipulation here refers to the hands-on adjustments Dr. Korikov performed.
Gentle adjustments, the source said.
Yes, gentle, precise movements aimed at realigning those vertebrae. The goal is to take pressure off the nerves, improve movement, that sort of thing.
Got it. But it wasn't just the physical adjustments, was it? The source talks about education and empowerment.
Right. This is a really interesting aspect. Dr. Korikov didn't just, adjust him and send him on his way. He also educated Mr. Johnson, taught him about good posture, why core strength matters for back health.
And how to avoid activities that might make the pain worse.
Exactly. So it's about empowering the patient, making them an active participant in their own recovery, not just a passive recipient of treatment.
That makes a lot of sense. And the care continued beyond the initial phase. There was follow-up.
Yes, definitely. Regular follow-up appointments were part of the plan.
To monitor progress.
To monitor progress, see how things were going, maybe tweak the plan if needed. Plus, Dr. Korikov gave him specific exercises to do at home.
To strengthen the back muscles and help maintain the improvements long-term.
Precisely. Supporting that spinal stability.
So after all this, the adjustments, the education, the exercises, the follow-up, what were the results for Mr. Johnson? How did things change for him?
Well, according to the source, the change was pretty dramatic. He reported feeling immediate relief after the very first visit.
Wow, immediate after dealing with it for so long.
That's what the source says. And then over the next 6 visits, plus doing the exercises,
He kept improving.
continued improvement, yeah, significantly.
Yeah.
He got his mobility back, could work at his office job without that constant pain,
That's huge.
and even started enjoying outdoor activities again, pain-free. That really paints a picture of, getting his quality of life back.
It really does. And the source includes a direct quote from him, a testimonial.
It does. Want me to read it?
Please.
Okay, Mr. Johnson said, "Excellent and affordable treatments with Dr. Venn put me back into comfort with my office work. I had lower back pains, and he fixed the pain during my first visit. Then I had 6 more visits and 2 exercise sessions. I feel great."
I feel great. Simple as that.
Yep. And it notes the date, too, February 1st, 2023.
Okay, that's quite a powerful personal account.
Yeah.
So the main takeaway from the source seems to be positioning Advantage Healthcare and Dr. Korokoff as a successful example.
Yeah, it presents this specific case as evidence that chiropractic care can be effective for this kind of lower back pain.
It illustrates one possible positive outcome.
Exactly. And the underlying message seems to be if you're out there listening and struggling with similar back issues, maybe chiropractic is something to look into.
A natural approach to consider.
Right. The source even says something like, healing begins with understanding your body and finding the right partner on your journey to recovery.
Finding the right partner. That fits with the education and empowerment piece. And for anyone listening who might think, okay, I'm curious, or maybe wants to contact this specific clinic, Advantage Healthcare of Spartanburg, the source gives us details.
It does, yeah. It lists their website, though it doesn't give the URL. It just says it's mentioned. But it gives the phone number.
It's just
864-574-6840.
okay.
And the full address again. 1205 John B. White Sr. BLDD, Spartanburg, South Carolina, 29306-3929.
Got it. And they listed operating hours too.
Yep. Monday, Tuesday, Thursday, they're open quite long, 7:30 a.m. to 7:00 p.m.
Okay.
Wednesdays and Fridays are shorter, 7:30 a.m. to 1:00 p.m. And then closed weekends, Saturday and Sunday.
Good to know. And they mentioned another way to reach out.
A contact form on their website. So, another option if calling isn't convenient.
Right. And you mentioned tags associated with the source material.
Yeah, things like back pain, lower back pain, testimonials, read our reviews, gives you a sense of the focus.
Definitely practical info for anyone whose interest is piqued by Mr. Johnson's story.
For sure. Offers clear next steps if this resonates.
Okay, so wrapping up this deep dive then, what's the core message we should take away from Mr. Johnson's experience as presented here?
I think the central point is that for him, chiropractic care at this specific clinic with this doctor offered a real path away from chronic lower back pain.
Through that combination of things we discussed.
Exactly. The spinal adjustments, the crucial education piece, and the consistent follow-up, it was a package deal, really.
It certainly gives you something to think about, especially if you're dealing with back pain yourself, or maybe just interested in treatments that aren't drugs or surgery.
Yeah, it makes you consider other possibilities.
And it leaves us with a couple of interesting questions to ponder, doesn't it? Like, what other natural or holistic methods might work for common issues like back pain?
And maybe more broadly, what does it really mean to partner with your healthcare provider, to be actively involved in getting better?
Good questions to mull over.